Good evening, everyone. I would like to start by thanking the National Patient Safety Center for bringing us all together here. I'm very happy to join this esteemed panel of participants. It's always very refreshing to speak to civil society organizations. Their inspiring stories, commitment, and passion are a driving force behind many of the accomplishments in the social and healthcare sector in Saudi. So it's an honor to be with you. My name is Rahaf Al-Sanusi. I'm the Director of Policy Design and Advocacy at the King Khalid Foundation. Um, um, I'll share part of my work and what I do in relation to today's panel. But first, allow me to introduce our esteemed speakers. First, my apologies, Mr. Fahad Al-Anizi. He's an economist, a cancer survivor, and a co-founder of an association, Mutaafi, that supports cancer patients and survivors. He's an experienced in leading NGOs and teams and making impactful values. He's also certified in strategy and business planning. Thank you very much for joining us today. We're also joined by Dr. Amal Al-Saif. She's a professor in AI and computer science. She's also an expert on assistive technology for enhancing quality of life of people with disabilities and elderly using technology. She's the founder of Tawasul Association for Assistive Technology for People with Disability. We're also very happy to have her. Finally, we have Mr. Ahmed Al-Kashami. He is the chair of Type 1 Diabetes Association. It's an honor to have you all here and to kickstart this discussion to understand the role of NGOs and civil society organizations in Saudi Arabia in promoting patient safety. As part of the work that I do at the King Khalid Foundation is to produce research around the civil society sector in the country and to identify nonprofit trends in the country. I'm happy to report that since 2021, we've witnessed a huge increase in the number of NGOs in the country. Today, we have approximately 36,000 NGOs, growing from 2021 by 400%. That's a huge jump in the number of NGOs just in the previous 2 years, which highlights the growth of need in the sector, but also the growth in the trust in the NGO sector and the services that it provides. When it comes to the health sector, there are about 11% of Saudi NGOs that work in the health sector and that work in promoting and contributing to the health transformation program, which is one of the Vision 2030 vision realization programs. Also, 8% of Saudi NGOs contribute to the Sustainable Development Goal number 3, which is good health and well-being. 5% of NGOs are health NGOs in the country. We're very promised by the recent moves in non-profitizing a number of hospitals in the country, such as the King Faisal Specialized Hospital. This move to change the model of providing healthcare services into a non-profit model should be very promising in enhancing the quality of the services that are being provided, and also making more way for NGOs to contribute to patient safeties and other issues in the healthcare sector. But enough with numbers, and let's hear more about the stories on the ground, the great work that NGOs do in promoting health safety and patient safety. And we will start with Mr. Fahad Al-Anizi, learn more about Jamiyat, our Mutaafi Association, and how it supports cancer survivors and their families. Mr. Fahad, please take the floor.
Thank you very much. Thank you for this kind of introduction, and also for the information that you have feeded for the NGO. First of all, let me share what I have prepared. We have promoting patient safety among civil society. Ta'afi has done a lot of work to promote patient safety, and the need of patient safety is something that we need to conduct in the healthcare system. First of all, what's civil society? So we can understand the civil society as a definition, and also what can it do for health to make sure that it's suitable understanding to achieve the goals. Civil society refers to collective group of individuals that operate independently, not biased to the government side or private sector to be looking for a profit. It need to make an impact to promote and address the issue. So we have three main elements that needed to be understandable for to describe a civil society. It's a collective group that work independently, addressing issues that they are facing through the journey that they are facing. So there are four critical roles of civil society. There are many roles that it can play, but the four critical roles that it work as a bit of an intermediary between states and the individuals. It expresses their need. It's expressing the value that they are aiming to. The second one is providing a platform of citizen and partnership and public affairs activities. They are participating and providing a place that they are expressing and making sure that they are in the same track, trying to develop the same sector, express their interests and concerns. How they can address this kind of issue, they can't express it well and address it to the same concern that everyone had at the same journey. Contributing to the development of functioning society, how it can play a critical role, contributing in economic development or in a governmental development. There are many ways to engage civil society organizations, and the World Bank Group engage civil society around the world to create some other solution that it may affect other people well-being. They are doing like six kind of roles that are mainly focusing on civil society, starting with advocacy and priority. They are putting the priorities list among the need or the achieved goals that they are aiming to, and they advocate people where are they going. Policy assessment and adjustment, because they are one of the user experience is to understand what they are using and how to make it more smoothly to the public good. Consulting and public strategy. They are contributing to develop a strategic policy or a strategic point of view to achieve, to deliver from a certain point to the other as one of the stakeholder, or the main stakeholder as end user. Inform based on data or experiences based on the journey, so we can enhance and develop the same culture or the same sector that we are making group of. Operational and technical support to deliver services. Because it interacts with a human being, with individuals. So it's a collective group. They can operate and deliver some other kind of services to the public good to achieve the governmental or higher expectation that they are aiming to give us services. Partnership and capacity building, like what we are doing now, what we have done before, using the experience to enhance and develop the initiatives and program to the user need. Civil society and health play a critical role, and Mutaafi did a lot of activity in the past years, so we can understand from lesson learned. advancing public health goals, because we are one of a national members in the Kingdom of Saudi Arabia. So we are activating International Health Days to interact with international worldwide with the same issue or error, so we can enhance and develop for the public good. Patient engagement, how we can participate and engage patients into the healthcare system so they can give a valuable feedback to the healthcare system and circularizing the development cycle. Advancing in awareness. Advocacy is one of the major things that Mutaafi did to promote other things like the treatment plans and how it's a treatmentable, what you will face in the journey, so you can understand and estimate. Improving their system. This is one of the major things that many civil society works on. Mutaafi did participate in national as one part of the main stakeholders that presenting the needs and requirements for oncology strategy. Participating in patient experience conferences to express the journey, what they face, so we can understand from lesson learned through the journey itself. Workshop for patient safety. This is one of the main things that we did before to understand how we can develop this kind of issue or this kind of error from a perspective of a patient and their practitioners. Patient empowerment and training for healthcare providers. This is how we can empower and train patients to be focused, oriented to the same issue and find solution that is suitable for them and for the healthcare providers. Sorry. Civil society, they have advocacy policy influence that advocate for health-related issues, services provision, so they can contribute and influence, give delivery for healthcare services to the inaccessible cases, medical care, other services that they are deliver to people who are, let's say, in economic ways, they are less lucky than the people in the capital cities or the busy city. Communicate empowerment and participation to empowering and community to actively participate in decision affecting their health and other people's health through their experiences, enabling community to take ownership in their health and well-being. Research monitoring. This is one of the main things that civil society works on. Research. They collect the data because they are participating with individuals, so they can understand and collect the data and monitor the health related issue through certain point of error that it's facing the healthcare system. Also capability and capacity building of training sessions, strengthening the capacity of healthcare system is providing training programs, workshops, and skill building to the needed services or the service delivery healthcare provider and the healthcare quality to maintain the what we are achieving and aiming to do. Social mobilization and behavioral change, how we can transfer patient or a journey from a way to other, mobilizing community to adopt healthy behaviors, promoting diseases prevention. So we can do a pre-work of patient and diseases, addressing social determination of health, human rights and equity, so we can make sure that everyone is happy, healthcare acceptable, and no one is injured, and the quality is for all, high quality for all. Mutaafi has contributed in categories by promoting patient safety in C20 agenda This is one of the policy influence, advocating current patient families and their social about and the society about cancer diseases. A lot of concerns had been a wrong misunderstanding to express the journey, and we try to enhance and develop and raise the awareness of people about the disease itself. Service provision. Mutaafi did healthcare virtual clinic through COVID-19. This is one of the main things that we did before. Patient virtual support group. We did. So we do a support group to the public in hospitals. After that, after COVID-19, we came up with a solution that it prevent human interaction into a virtual interaction to support patients in hospitals. Open close therapy we do with our volunteers specialized. They are doing a lot of work to understand, do the therapy for the current patient and ex-patients. Training for ex-patient and cancer survivor. We have done a lot of training sessions for them, such as business plans, so they can enhance and develop themselves to deliver a good quality of deliverables for their own career. Community empowerment and participation, health days, participation, sharing experiences. This is one of the common thing in civil society, to share their experiences and give the feedback to the system. Mutaafi expert, we have done such a great job with healthcare providers and to prevent tools encouraging patients to speak up about their healthcare decisions, how they can enhance and develop their treatment plan. Participating in conferences, sharing knowledge and experiences. One of the main things, the research, as I mentioned before, is one of the on the contribution sectoral Mutaafi did in this month. Capacity building and training, promoting patient safety is one of the things to the healthcare providers in empowerment, patient safety, and patient safety partnership, design thinking workshop to enhance the care system and patient journey, social mobility and behavioral change, survivors at hospitals, visiting their newly diagnosed patient to share their experiences, to influence current patient, to enhance their journey to make it smooth. Human rights, there are huge efforts in Saudi Arabia among healthcare services, and the hospital support human rights and align with the Vision 2030 agenda, that it's acceptable for the healthcare quality of services and enhancement to the system itself. This is some of many activities that Mutaafi did in the last decade, let's say, because it's a long time that Mutaafi did activities, visiting patient empowerment, encouraging, advocating to the public good, also co-designing workshop for delivering services such as healthcare. In that matter, to promote healthcare, and why did it come like that? Mutaafi, it was established as a volunteer group. The story behind Mutaafi, how it started. It was established as a volunteer group that people, survivors at 2019, they are beginning the journey when they face a problem or a dilemma through their journey and experiences, because they didn't understand what they are facing. Why it started? The reason behind the establishment was the lack of psychological care needed for patient and their fear disease, because there was a lack of health cultures who it was targeting. The primary goal to support patients that are recovering from cancer and their families by individual who are recovered from it. So one person who got into the journey need to advocate for other to pull him to take a smoother journey, to encourage the patient to move on in the journey and to get to the recovery. What did it do? It worked to explain treatment mechanism, educate and communicate, educate community about cancer. What's the correct answer for their concerns, and to raise the awareness, to make sure that there is no misconceptions through the community that's based on nothing. Where it was Mutafi expanded to include all of Kingdom of Saudi Arabia to cover almost 13 regions in Saudi Arabia. So in each capital region, it has its own supporting group that participate with the healthcare facilities. Contributing to improve patient engagement and empowerment. This is one of the main things that, as I mentioned before, it worked actively designing thinking workshop that brought together recovered patients and health practitioners at one table. We brought an issue that they are facing. We brought ex-patient and healthcare provider at the same table, trying to solve this kind of issue that it's acceptable to the patient and the healthcare provider to provide this kind of services. So with low quality or low cost of low cost at low cost. So we determine three kind of phases that for the patient journey. It's the diagnosis at the beginning, then the treatment plan as it goes to the third phase, the recovery, and then we agreed upon all practitioners from multi point of views to address this kind of matters. Contributing to improve patient engagement and empowerment. During the period, Mutafi created a solution that prevent people from interaction through the lockdown and the complete lockdown that happened to the community. It brought Mutafi with you at home at the first beginning of the lockdown. The impact of this kind of initiative, we've got 7 guests. The third guest, it's the expert guest, so they are responding to the patient concerns every Thursday with experts. Patient supporting sessions, we've had 11 sessions, 6 visits online. We've had 2 80 hours volunteering volunteers hours spending in this kind of initiative. Also, 27 doctors and specialists in oncology. They are responding to the concerns of people and families of patients. 145 opportunities has been raised to many people to volunteer and participate in this kind of effort. One of the main thing is the impact of beneficiary. Beneficiaries has raised to 11,000, more than 11,300 followers and beneficiaries at that kind of at that initiative during the 2 months activities. Mutaafi won the National Patient Safety of Non-Profit Organization presented by Saudi Patient Safety Center. Also, it participated in 2019 in patient safety conferences, speak about patient engagement and how we can engage and give solutions to the healthcare providers. Mutaafi contributed to promote patient involvement and promoting and empowering them. We have published an article at the Journey of Patient Safety. Talking to me could save my life. Talking to me, if you talk to me and share with me my experience and understand my concerns, I could prevent something from happening that I'm not telling you. This is a summary of what we have read in this kind of article. Other contribution, participating in training courses for health practitioners in patient empowerment and involvement. We have done such a great job with the Saudi Patient Safety Center to empower patient involvement through healthcare practitioners. The impact of Mutaafi during the period of time from 2009 till now, we have supported research related to disease. We've provided more than 17 services, more than 50 partners, more than 30 projects, and about 45,000 beneficiaries during this time. The role of non-governmental organizations in supporting patient safety. Patient safety, healthcare numbers worldwide, one patient out of 10 in high-income countries is harmed while receiving care in hospitals. One of 3 people report negative experience in their healthcare system. 5.7 to 8 million deaths.
Mr. Fahad, I'm very sorry to interrupt. But you're over time.
Sorry for taking much more.
Although you've reached a very important point where you wanted to discuss more the role of NGOs in general in promoting health safety or patient safety. I'm sorry. Let's try. I'll get back to you if other participants are on time for you to finish this. But we'll have to move to the next speaker if you allow me.
Yeah, okay, no problem. I'm sorry for taking too much to speak.
No, thank you very much. Thank you very much for this very insightful presentation and for highlighting the developmental roles of NGOs. Now we'll move to our next speaker, Mr. Ahmed. Mr. Ahmed, are you ready?
Yes, ready.
Okay. We're very excited to hear from you about Type 1 Diabetes Association. The floor is yours. Go ahead.
Assalamu alaikum. Thank you for having me here today. And I'll start talking about promoting patient safety among civil societies. Supposed to be here, Dr. Shaima, but she had a surgery yesterday. Because of that, I'm here with you today. We'll try to reach those objectives during our presentation. I will not give a long time here to have time for the other slides. That's some information about Dr. Shaima. She get all this CV while she is type 1 diabetic. Why we founding Type 1 Diabetes Association? I have lived with Type 1 for about 15 years, and Dr. Shaima for over 20 years. It's tough, but also gives us a unique perspective. Managing blood sugar every day is complex, and I'm now putting my blood sugar in the screen to monitor my blood sugar every minute, every second, 24 hours. And not everyone gets it, but it's not just a basic job. The whole community has a role to play. That's why help to in founding Type 1 Diabetes Association. When we talk about Saudi's Vision 2030, we cannot forget about the Quality of Life program, which is a part of Saudi's Vision 2030. For people with T1D, quality of life isn't just about medicine. It's about work-life balance, support, and community awareness too. Being motivated to manage your condition is key, and they're easier when the whole community is informed and supportive. And when Sayyidi Prince Mohammed bin Salman said طموحنا عنان السماء, it is not just a word, it's hard work. We need to work harder to reach this goal, and we need to put our vision as much as we can. When we talk about type 1 community, it's not we are talking about the patient themselves. We are talking about that's our vision in the association. We are talking about people with type 1, family of people with type 1. We are talking about the type 1 healthcare and other service providers. We are talking about society. Why we are talking about society as a part of type 1 community? Because when the whole society understanding what is the type 1, that will make our life easier as people with type 1. And anyone from the society, maybe they will move to they will be as a patient in any time. If they have a lot of information, they will join and they will make the healthcare provider work easier. And our goal is to bring everyone together to work toward common aim. We focus on open communication to understand how the disease impact the individual and those around them, whether healthcare providers, decision makers, or patients. Everyone has challenge, and the association aims to bridge the gap between them. The key affects communication and respect for each other, setting strong foundation for a better future for those living with type 1. Our vision is clear. We believe everyone with type 1 can lead a normal life if their needs are met, but we aim higher. We want Saudi Arabia to become a global leader in type 1 care. Our goals guides us. We focus in empowerment, providing everyone. We mean patient, healthcare provider, decision makers, community, all people, the tools they need, and collaboration is the key. We cannot make progress alone. We need to work together. Our ambition is big, yes, we know, and we aim to set a global standards. A deeper understanding of the disease drives our work. When we understand our disease, because we know type 1, it's not clear. No one can say why this happened and what's the solution. No one can say that. But when we try to think and find the solutions, or to understand this more, we'll find a solution. And the awareness. When we improve the awareness, that will help to fighting the misconception and the risk. Our goals, we are talking about the quality awareness. We are talking about the trainings for the patients and families and the healthcare providers, the whole communities. Um, from our goals, excellent medical care that will help, and I think if we work together, we can find a solution, and we find the best ideas for healthcare or medical care. We have issues with the data. If we don't have uh, a reliable and accurate data, we cannot do anything. We cannot do anything without data. While we are working, when we said just diabetes, and we put some information about this as a diabetes or some numbers about diabetes, that's not will help. Type 1, that's a disease. Type 2, that's a different disease. If we want to have a right data, we need to separate every part and put the data and work in it as a part alone. Don't mix everything together. That's one of our goals. Our current some project before that, we established the association. It's less than 1 year. It's 13 November 22. It's 1 day before Worldwide Diabetes Day. That's this some numbers from our project. It's Type 1 diabetes space. It's about weekly space in Twitter. It's for about more than 2 years until now. We have in social media more than 5,000 followers. We have more than 80 spaces yet. We have more than 135 guests in those spaces. We have more than 29,000 listeners. For the, we want to talk about the future project. We aim to share knowledge, resources, and best practice, ultimately enhance patient safety um, through coordinated efforts. Raise awareness about unique patient safety risk factor by individual with type 1 diabetes through educational matters, checklist, emergency actions plan, resources, mental health and emotional support, and responding to common diabetes-related situation. Providing education and training program to healthcare professionals, patients, and families on diabetes management and other things related to type 1. Best practice and lesson learned on the patient and family engagement. Many research talked about this subject, and this provide the valuable of contribution to engage the patient and families and work. We can make it short. If they work together, they will reach better result. Managing information flow, patient safety is very important, especially for people with type 1. We live in a term where information is everywhere, but it can be both good and bad. The internet has a lot of information, but not all it's correct or not all useful. People with type 1 diabetes often find themselves confused by this information. It's important to know how to tell good information from bad. We need to help them to separate the right information and the bad information. We need to help them to understand those information, not to help them to tell them that's right or not, because you cannot be with them 24 hours. Having a common language, we did talk about the 4 communities, or the patient and families, the healthcare providers. Each part of those, they have a common language. It's difficult to understand the when we talk with the healthcare provider, maybe we'll get about 5% from their information. But when I talk with another patient, when he talk with me the same subject, I will understand maybe about 80% of his things. Even if I cannot do what he said, but in I would think that if he can do it, I can do it. But the healthcare provider, when they listen to us, it's difficult for them to understand our feeling. But if we work together, we can make the gap maybe shorter, or make the make this language going from layers to another layer, or from community to another community easily, because we are closer to each other. When we ask individual with type 1 diabetes about the most significant factor that enable them to live a better quality of life with less stress, they will likely point to diabetes technology or type 1 diabetes technology, because managing type 1, it's like a manual. You are moving the machine from working as a automatic to manual. You need to control everything. The technology will help the patient to make their life easier. Even the CGM, that's continuous glucose monitoring, or the insulin pump, and will help the healthcare provider their work easier, because they can monitor my blood sugar 24 hours. Before, when you walk to the healthcare provider or doctor or diabetes center, we'll give them just numbers for maybe a week. That's just 4 numbers for one day. That will not help. He cannot see your life. He cannot see our life to say, okay, you can do this or that. But with the technology, that will help us as a patient, will help the healthcare provider to make our life easier. It's not just a patient. We are one community as a patient, healthcare provider, service providers, society, families. We are one community. We need to work together. The conclusion, we are here to talk about type 1 diabetes, a big health issue. The key making life better for those affected is working together as a community. This includes give health information, as well emotional support to patients and their families. Partnership with the organization that focus on type 1 diabetes are really helpful. It's time to effort to make sure everyone with this condition is safe and well supported. Let's keep working together, sharing what we know and doing research. This way, Saudi Arabia can become a leader in healthcare and safety for people with type 1 diabetes. Thank you.
Thank you so much, Mr. Ahmed, for perfectly sticking to your time. You've ended on a couple of positive notes, but also you've prepared us for the next speaker when you started talking about the role of technology in promoting patient safety. We will hear more about that from Dr. Amal Saif, who's the founder of Tawasul, for People with Disability Association. Dr. Amal, the floor is yours.
Assalamu alaikum. Does the screen appear now?
We can hear you and we can see the screen, but if you can please click on present.
Assalamu alaikum. This is Dr. Amal Saif. I have a PhD in computer science. I'm a founder also for Tawasul Association for Technology for Disabled People and Elderly People as well. I'm here today to discuss the journey behind establishing this innovation center, Tawasul Association, and being a mom of a patient for 10 years, and how this encouraged me to establish this organization. So I will say a little bit about the story of as a mom of patients for about 10 years ago and till now. Why the communication is very important, and what is Tawasul Association, and what are the achievements it's achieved right now, and how to work with Tawasul in the medical field to enhance the awareness. So back in 2030, about 10 years ago, my son had an accident and he became disabled. He cannot move, he cannot talk, he couldn't even breathe at that time. He stayed at the hospital, different hospitals inside, Saudi Arabia and also abroad, about 2 years. So from ICU to the ward, from different places. And for us, we start from that time to be, dealing with Anas, how to communicate with him, how the patient, the doctors and also the health staff dealing with Anas as a patient. He cannot talk, he cannot move. So the patient, the doctors, and also the medical staff, when come to his room, they asking me, how is Anas? So I told him that time, talk to Anas. I'm not Anas. So they replied to me, how to talk to Anas? And Anas doesn't have voice. But I tell them that there are many techniques and technologies and tools that give you the ability to communicate well with a patient. And we work together with the medical staff to, invent or also to design new communication tools for Anas. Anas now studying computer science as well, and also he's a programmer. He is he's still on the chair. He still cannot talk. However, he communicates very well with others using assistive technologies. So from this experience, I come here to Saudi, about 8 years ago, and stay with different hospitals, rehab centers. And asking about what are the assistive tools that we use to communicate with patients in the ICU or in the ward and also in the clinics. And the answer, we don't know. So and this is a big issue, and this is the starting point of establishing our association. It is non-profit association under Ministry of Telecom, and it is dealing with enhancing the awareness, one, two, programming any tools that not exist that should support Arabic or our culture. Three, also train the medical staff, either in the hospital or also the family members outside the hospital, to deal well with disabled people. Anas, alhamdulillah, memorized Quran, contacts with all friends and studying in the university right now, and all of that because, alhamdulillah, after يعني فضل من Allah, the assist technology that we provide for him. If you see Anas in this picture, you can see what the يعني.
So perhaps in the meantime, I can start just summarizing what our speakers have been sharing with us, with the hopes that Dr. Amal will interrupt me with her presentation back on. So Mr. Fahad Al-Anizi was from Mutaafi, talked to us about the different developmental roles that NGOs can play in support of patient safety, but also in support of them receiving the healthcare services that they need. So he talked about their role as advocates for patient safety, but also as conveners who can bring patients, healthcare professionals, and NGOs and policymakers together. With that note, I can see the slides up now. Also, Mr. Fahad talked to us about NGOs as consultants and experts for policymakers, but also for healthcare providers. He talked about the role of NGOs as service providers themselves. So many NGOs excel in providing services, whether they be healthcare services or educational services or rehab services for patients. And also their active role as in formulating national policies and strategies. And he gave an example of the role of Mutaafi in formulating the National Oncology Strategy Plan. Also, NGOs play a very important role in supporting patients and their families, and bringing them together to support each other, which is a very important role for NGOs. Dr. Amal, are you back with us? Are you able to share your slides? We can see the beautiful photos of Anas in front of us now.
So
please,
here, yeah.
Please continue.
Yeah. So here is Anas, and I told you about Anas' story and how he's now a very successful person, alhamdulillah, using assist technology, and all these technologies encourage us to establish an association to pass all the success, achievement that he reached to other people, either patients inside the hospital or outside the hospital. So disabled people is around 7% of population in Saudi Arabia. And the study said that one or more people, one of each 5 people could have one or more disability problems when they get elderly. So we talk about all kinds of disability, even not hear, not talk, not see, and all that of, because even the elderly people at some point after, for example, trauma or anything, they become disabled at some point. So we are talking about the technology and how enhance quality of life inside the hospital and outside the hospital. How the doctor and nurses communicate with people without voice. how would they communicate with one they don't know what are the language they use? For example, deaf people. So here, the assistive technology come and solve all the communication problems, and I mean, different kind of solutions. We have low technology, we have mid technology, we have also high technology using, AI and all kind of, advanced technology. As our colleague said, vision of 2030 encourage all of us to do what we can do to improve the quality of life. And that's true for 3 different sectors: quality of life, and also digital transformation, and also the healthcare transformation. Now back to the assistive technology for disabled people. As we say that we dealing with 3 things: develop a new technology, enhance awareness about existing technology, and also provide the technology for people they don't have money to have it, either in the hospital or outside the hospital. And also contact with social responsibility from the private sector and also the government sector, and sit together and give all the advices and recommendation on how to improve quality of life using technology. So how it is work? So we have evaluation. We do brainstorming to find the good technology that enhance these individuals. Select the devices or softwares, what they are. I mean, if they are local or abroad, we bring all the technology from all over the world here to the Saudi Arabia. And if you come to visit us in the Societie, you will see amazing devices, more than 400 devices and softwares under one umbrella. And also we do training for patients and the family members, and also training for the staff in the hospital. What are the assistive technology that they need to communicate well with patients and also the family members? And lastly, we do the follow-up. So we save more than 500 people with all kinds of services. We have OT, speech, PT, social workers, special education, and also IT and 3D designer to invent a new solution for everyone. So here is amazing center that solve huge problem. Okay, they are not medical problem, however, they enhance the patient safety and also communication quality of life. And this slide has come from a different presentation, but to show the numbers that we reach with. And also we exist in Ihsan and also Waqfi and all the government platforms to gather money for people they don't have money to have our services. Here, examples about 2 amazing, softwares that we work on. And it's already now published on the internet. The first one, Hayat platform. The Hayat is a platform. It is like Wikipedia, all about disabled people in Arabic language. So before they be disabled, after, during, encouraging awareness, all in Arabic. And also I encourage all of you to be a user in this amazing platform. We work hard in this platform, more than 300 people, volunteers, working in this platform. The other one is the Arabic speaker, and also this is a mobile application. This mobile application we developed here in Saudi from start to end. And the main point that we use artificial intelligence to make the communication easy for people who don't have voice and also speak Arabic. So this one allow, by the way, it's also speak English, but the mainly is Arabic is the main one. However, it speaks English as well. So we add all different features. We continue improving the application. So any kind of feedback or anything, just give us your feedback, and you will see all your comments next year, inshallah. So Tawasal has many achievements and awards from different, association, and alhamdulillah, everybody, like our work, the quality that we do the things, and they encourage all of you to work with us as well. So how to work with Tawasal in healthcare? Absolutely, you have a patient, and the patient, they have a problem. So just pass them to us, or we come to hospital as well. We come to hospital and also examine how technology can improve the communication for the people inside the hospital. Also, life after the hospital, we also enhance the quality of life after the hospital. We do also training for the medical staff, the BT, OT, the doctors, how to use technology tools, and you can work with us as a volunteer as well to learn, and also to spread the awareness about the all colleagues. 4 months ago, we got مبادرة العيش باستقلالية, working with Sanad Mohammed bin Salman. And I also ask you, if you have anyone that can get benefit from this work, just contact us, go to our website, and just ask for the service, and we will do everything that we can do for your patients and also for your staff in the hospital. Here are some links. The last one is my Twitter account. Before is the Hayat, the Manasat Hayat, and also the website of Tawasal. And lastly, I thank you very much for listening to my presentation. And sorry for the technical problems that we face currently. But think about the patients. As a medical staff, think a lot about the patient, because the patients, they have the right to know everything that's about their care. If you come to the patient's room, contact to him, not with other people, even mom or dad or anyone. Contact to him, ask him, tell him, smile to him. So the patient waiting for any small things to enhance their situation. So I ask Allah to please your work, and أنا دائما أقول دائما القطاع الطبي دائما أشبههم بالملائكة. So I'm happy to contact with you if you have any question, and thank you very much for having me today.
Thank you so much, Dr. Amal, and for ending on such a positive note, reminding our audience of how we all perceive them as helpers, but also as malaika or angels, as you put it. And thank you, special thanks for sticking to time, even though you had some technical difficulties, which I did not expect from the founder of Tawasul Association. But thank you very much for your presentation. I would like to encourage, first of all, thank everyone who asked a question in the chat box, and encourage others to also share their questions. But also, if you would like to raise your hand, we'll be more than happy to hear your question from you. That's also an option that is available to you. But after thanking all of the speakers again for their contributions and presentations, I can share some of the questions that we've received in the chat box. many asked the question of how to get in touch with you. I know Dr. Amal was able to share her contact information, but a general question that we received is about how can anyone support your NGO, especially from the healthcare sector. I would like to give the opportunity to Mr. Ahmed and Mr. Fahad to share the contact information of their NGO, or to share the channel that they would like to stay in touch with the participants today in this meeting.
I can start. Okay.
Please go ahead.
Go, Fahad. I'll start after you.
Thank you. We are in the X application as Mutaafi, and also we have our contact Mutaafi email address. I'll share it with the screen just in a few minutes to make it easy to access.
Or maybe on the chat box, that would also be helpful.
Yeah, it will be. Thank you.
And also, Mr. Ahmed, if you can also answer the question that we received about if you have any offices or presence in certain hospitals that people should be aware of.
We just started. We have less than 1 year. We have right now Twitter account T1D_SA. The website now almost ready, T1D.SA. We have the T1D space in Twitter, T1D-space.com, T1D_space in Twitter. They can contact us there. And we are working together. We are not giving a service. We are working to serve ourselves with the whole community.
Thank you very much. Another question that we received was about quality of life. How does each one of you, from the perspective of the patients that you serve, think that what quality of life, what does it mean for the patients that you serve? So how does a good life for them would look like if they're provided with all the services that they need? Would anyone of you, our esteemed speaker, would like to start?
Hello, hi. Yeah, this is Amal. So quality of life, that means people not only live, they enjoy their life. This is what's the simple answer or simple definition about quality of life. So they enjoy their life. How they enjoy their life while they are patients? So this is a huge question. Need a lots of things to do, social or awareness about many things. One of the things that what we deal with in our association, the assistive technology. So technology can solve a part of the problem, not all the problem. So we cannot, guarantee that we will enhance the quality of life if we just, train people how to use this technology. One of the technology, for example, that we apply in the hospital, that one of the device control via eye gaze. So people, they are not moving, they are not talking, either they have ventilator in their mouth or also for another reason. So just only if they move their eyes, they can select many things in the screen, contact with others, send text, open the YouTube, listen to Quran, do anything they want only by moving the eyes. See how amazing is the communication or the assist technology, so to enhance the quality of life for patients in the hospital. And I think from my perspective, it's doing a great job especially, for example, for my son now, 10 years, he's not talking. So assistive technology, I mean, play a great assistant for him.
Thank you so much, Dr. Amal. Mr. Fahad or Mr. Ahmed, would you like to try answering this question? What do you think quality of life looks like for the target group that you're serving?
The quality of life, it's focusing on, it has many aspects or many point of view we can, if you want to describe it. But mainly it focuses on some elements that determine the life sustainability of the human being. If we see ourselves, we are in the same loop of healthcare. This is one of the main elements of good quality. Most of countries focus on achieving a suitable, affordable, good quality of healthcare services to enhance and develop the human being life and for the humanity. This is why we focus on cancer survivors patients, and as well as my colleagues, they are focusing on other focus areas that the end goal is to enhance and develop the healthcare services that provided by the healthcare system and save their life to make it more enjoyable with no harm and no more dramatic stories.
Thank you very much. Another emphasis on the enjoyability of life, not mere survival per se. Mr. Ahmed, please go ahead.
About the subject, many things, but I think if you is a part of the a decision, you will the decision you will do it, because we are managing our debits the whole time. If I'm apart from the decision and part of the work, I will accept everything and I will do it better than when someone give me this thing and said, okay, do it. I will do it, but sometimes I will have a barrier inside myself. And another maybe side, we need to have less thinking. We need to have less working, even as a patient or healthcare provider. This when we use the technology and improve the understanding and the awareness, that will help us and the whole communities to have less thinking and less working for managing our debits.
Perfect. A question that I have to the speakers, from my perspective as a researcher, we only have 5% of our NGOs in the country working on health in general, including patient safety. Why do you how do you think we can encourage more NGOs to be formed in this sector? And is there anything specific that you would like to share with regards to the perception of healthcare professionals to civil society organizations and NGOs, and how would you evaluate that relationship and the trust between NGOs and healthcare providers and healthcare professionals? Who would like to go first?
I'll go first.
Go ahead.
Yeah. We need to work together. When we work together, we'll trust each other, because we are working for ourselves. If you work for yourself, you will trust yourself. But if you sometimes when I said when I give you something, maybe you'll trust me or not. But if we work together and I'm working for you and for myself, and you are working for me and for yourself, we'll trust each other. We need, yeah, that will take time. That will be maybe difficult way to reach it, but our goal to go to this direction.
Mr. Fahad, I see that you seem to be keen on answering this question. Go
Yes,
ahead.
like you've mentioned, I like numbers. And this is why this is my major. 11% is a good number if we come up with a good quality of and empowered organizations, such as Mutaafi. It has started from 2009 till now to build all of this kind of journey. I don't want to tell you because we will have more than 3 hours to explain the journey itself when you are establishing an organization, such as it was a volunteer group, till it has been transformed to an institutional and then to an association to be adopted. What has effect on us, because the adoption globally show the value of NGOs, that develop and encourage the third party, the third sector, to develop and make an impact to the social activities. Regarding to the healthcare, it's focusing on patient and patient first. This is one of the core values of Ministry of Health and their own agenda and their own strategy. He is the first one that came with the strategy, so we have to make him surrounded with multi options and multi people who are defending threats and not acceptable situation. That I don't want to make it harmful, but to enhance and make it a smooth journey to the practitioners and the patient themselves. NGO is developing and business development of the sector itself through the diseases, through the medical care, aftercare. As we mentioned, Mutaafi worked to make a separation between the phases of the treatment plan, starting with the diagnosis and the treatment plan itself. They have concerns. There is an issue with patient safety during the treatment plan, and then after that to the recovery. So we have the lesson learned to raise the voice of the patient to the system. So the NGO increasement should involve patient to accelerate the strategic objective and the strategic goals.
Thank you very much. Dr. Amal would like to hear your thoughts on this question.
Yeah, I mean, we have three sectors: the government and the NGO, and also the private sector. So the government, including, I mean, in our case in Saudi Arabia, most of the hospitals, they cannot do everything alone. We need to work together. We need to plan together. Not all. We are not money giving association. We are not just having fun to attend events, and we more than that. I mean, for example, Tawassul Association are giving services, so giving awareness and also services and also devices. So dealing with association with different mentality can enhance the relationship between the NGO and also the medical staff and also the hospital. Any NGO comes from a need. So if you have a need and you have many people, they need the same, so you can establish a new NGO. And it is not difficult, and we can help you in that. However, it's not easy. So we need to establish services, we need to establish everything to make it work right, and also to be, I mean, continue to serving the people. The other thing that the volunteers. So we need to get in the hospital. We need to encourage the staff, medical staff, to work with an NGO, to suggest not only just, I mean, attending and also participating in the academic field, research or something. No, you can do more than that. So you can do different stuff, depends on the NGO that you are participating with. So yes, we face many difficulties in the hospital. Yes, and we need to solve them. So we need to sit with I mean, managers, to ask them that we are not, I mean, extra. We work with you to enhance the quality of life. So please sit with us and listen to us, and also contact us if you need anything. So we are more than happy to help. I mean, any people and also people in the hospital as well. Thank you very much.
Thank you, Dr. Amal. This is, I think, a very important call to action to wrap up our session today. So we were asking healthcare providers to, sit with NGOs, hear from them about what their patients need, and also how to improve the overall quality of life of those patients. I would like to wrap up with a question, just to share more insights about your work in the NGO sector. What is one lesson that you've learned from establishing your NGO that you would like to share with our audience today? Let's start with Mr. Ahmed.
That's not easy. Yeah, but we need to work hard, and you can do anything. We are now in the vision 2030. The vision that's open all gates. We can do everything. We can go forward. We can be the leaders. We need to be like, before we said, okay, we need to be almost like others. But now we need to be the leaders. Not just award a leader. No, we need to help people. We need to help the worldwide. We need to find a solution. We have people. We have everything. We have thinkers. We have. We can do anything, but we need to work. We need to work together. We need I think the key. We need to work together. I don't care if type 1 diabetes association is everywhere. No, I don't care about this. We need to work together for any names, for our country, for our worldwide. We need to work together to reach the maximum.
Very clear. Mr. Fahad, maybe you can tell us how your journey with Mutaafi made you realize something, or a main takeaway from you from that journey.
As my colleague Mr. Ahmed said, it wasn't easy to start up association to that level or to that length, at least. You have to encourage people, to give them passion, to understand their needs, and to achieve and direct their objectives to maintain a good goal. So it has many stages that you have to maintain daily basis, so you can reach to defend a case. In Mutaafi, I am as an ex-patient. I experienced cancer, and I was one of the patients at that journey. I've tried it in the healthcare system of Saudi Arabia and outside. and I've noticed the difference between them. So I understand what kind of elements that are missed here and there. What can prevent something from happening here? And they are exceeding there. They are doing much more there. What we are missing here, so we can fill this kind of gap in the healthcare system with simple touches. It's not about making major stuff. We have got a good treatment plan here, as well as they have to do there. But how we can enhance this kind of treatment to make it more a human side and also more emotional, effectiveness to the patient themselves and their families. Imagine yourself, you are in an aircraft and the pilot drives the airplane. They don't do the job by just dealing of the pilot. When we are sitting in an airplane, everyone as a passenger open their window to check and notice what kind of danger that they are facing outside. And this is why aircraft has less problems in the field rather than other human interaction. Patient engagement is like an airplane. You have a lot of passengers during this kind of journey, and the doctor leads this pilot as a pilot. Nurses are like flight attendants, so they are trying to make a smooth journey. But if I'm not sure that where the destination that I'm aiming to, I don't know what happens to the departure or the takeoff. I don't know what's going to happen to affect me outside. I know that I'm going to reach this kind of destination, but how I'm going to go there? Mutaafi has a lot of experiences in Saudi Arabia. This is why we have done an international patient safety, patient engagement webinar with the Canadian Patient Safety Institution and ex-patients from England to understand what they are seeing there, what kind of perspective that they are aiming at, so we can prevent that from happening in our system. This is a worldwide sharing experiences to enhance the system inside of Saudi Arabia, so we can develop the treatment plan with the given of the healthcare system in Saudi Arabia.
Thank you very much. Dr. Amal, any final thoughts or remarks you would like to share with us?
Yeah, thank you very much. Just to add that, believe in what you think that is right, and plan to target what you want with the correct people. Don't listen to anyone that, oh, it is difficult, you cannot do it. No, we can do it together. We can sit together, we can work together, we can achieve what we want together. However, you have to be patient, you have to be, you can, remember that you are not doing that for money. And this is the very important point, that we are not doing that for getting money. We pay money, we pay our time, we pay from our health as well to help NGO and also to help people. So just, try to be positive and also work with others, and inshallah, Allah will help us, inshallah. Thank you very much.
Thank you very much, Dr. Amal, and thank you very much to all our speakers today. A very warm thank you to all the participants, the hundreds of participants who joined our session today. We value your time and your attendance. I hope that by attending this session, you were able to have a better understanding of the impactful role that NGOs in Saudi have when it comes to promoting patient safety. I would like to leave you with a very short summary of what all the speakers have shared with us when it comes to the different roles that NGOs can play. NGOs have amazing outreach power to the most vulnerable in any society. They have an unmatched ability to collaborate, convene. They also play important roles as experts and consultants in policy design and in advocating for policy changes and for the voices of the patients that they serve to be heard by healthcare providers and policymakers. They play important role in service provision and also in supporting patients and their families. And finally, many of those NGOs are amazing innovators with great passion to find new solutions to serve the patients and promote their safety. With that, I reiterate my thanks to the participants and the speakers, and I wish you a very good evening. Thank you very much, and goodbye.
Thank you very much.